Now that you know the causes, you probably realize that TBIs can be prevented. So let's talk about risk factors so we can work together to prevent TBI. Some risk factors you cannot change. For example, being male is a risk factor, and being within certain age ranges is also a risk factor. Having had a previous TBI is a risk factor. It is important to be aware that these factors increase risk even if the factors cannot be changed. Other risk factors that are changeable include alcohol or substance use and abuse, participation in activities that involve contact or collision, having jobs or being in environments that involve weapons or violence, including being in unstable, violent relationships. Another risk factor is unsafe driving and other risk-taking behaviors. Another risk factor is significant depression or history of suicidal thoughts. Some groups may be more at risk for certain causes of TBI. In Native American or Alaskan Native men, there are increasing rates of suicide or suicide attempts. They also had the highest rates of motor vehicle crashes. Black and African American men have a much greater risk of dying or injury from firearm-related TBIs than all other races. Also, because of their higher rates of incarceration, they are more likely to experience TBI in those settings. These risks for Native American and Alaskan Native men and Black and African American men are largely related to a combination of social and economic inequalities, rural and healthcare disparities, and other associated stressors that people of racial and ethnic diversity experience while living in the United States. In white men, the past several years have shown increasing rates of suicide or suicidal attempts. While falls are listed as the official main cause of TBIs in women, domestic violence has been called a silent epidemic, and the majority of victims are women. Though TBI in military personnel and in athletes receives much attention, more women are victims of TBI because of domestic violence than those two groups combined. Falls are a major cause of TBIs in elderly people. Also, the exact numbers of TBIs because of physical elder abuse are not known, and elder abuse is more likely to happen to women. To reduce risk, talk to your doctor about management of your medical conditions if they are risk factors. For example, if you have mobility, balance, or vision issues that may increase your fall risk or impair your driving ability. If you are on medicines that cause dizziness or drowsiness, and if you have mental health issues or illnesses, especially if you are experiencing significant depression or suicidal thoughts. Pause here if you need to talk to someone now, or pause to write this phone contact information for later use. To reduce risk, reduce use of alcohol and other substances. Wear protective gear, but know their limitations and do not let them give a false sense of security or protection. While they may help prevent skull fractures, they do not prevent brain injury that occurs when the brain bounces around inside of the skull. Reduce your risk with safe driving practices and reduction of risk-taking behaviors. Take fall prevention measures. Reduce exposure to weapons and violence. Get away from violent environments and relationships, though that is easier said than done, and doing so may require help. For victims of domestic violence, pause here if you need to talk to someone now, or pause to write down this phone contact information. For victims of elder abuse, pause here.